Inner Voice, a heartfelt chat with Dr. Foojan.
Break free from the forces holding you back. Get the life you deserve. Eliminate stress, reduce anxiety, decrease depression, and start living your full potential. Thousands have used Dr. Foojan Zeine's awareness integration theory, an evidence-based behavioral health breakthrough with incredible life-changing results. Getting rid of past trauma, having fulfilling relationships, increasing earnings, and living their best life. Now, the Foojan app is available to everyone. The app is Dr. Foojan Zeine's awareness integration theory in the palm of your hand. Download the Foojan app today.
Hello, everyone. Welcome to the Inner Voice Podcast, a heartfelt chat with my wonderful guest and you beautiful listeners and viewers. I'm Dr. Foojan Zeine. I'm a psychotherapist and author and the originator of the awareness integration theory. So great to be with you today. In this episode, I am excited to chat with Dr. Marcello Giuseppe Tanca. He has a PhD in neuroscience. He's also a clinical psychologist, and he joins us from Italian island of Sardinia, which he says is beautiful. I've never been there, but would love to go. He currently lives and works there in his private practice, performing psychodiagnosis, psychotherapy, and neuroscientific research. He was a visiting researcher at Stanford University before going back to Italy to teach neuroscience and psychodiagnosis at the psychotherapy specialization school in Cagliari, Italy. As a researcher, he studies in particular in relationship between inflammatory processes and psychological psychiatric symptoms, with research groups in the biomedical field that use cutting-edge approaches such as metabolomics and artificial neural networks. He published research in international scientific journals focused on PANS, P-A-N-S, pediatric acute onset neuropsychiatric syndromes. PANS is a syndrome supported by the presence of an immune pathogenic based on dysregulation of the immune system with the inflammatory correlates. Today, we will be talking about his latest book, which is actually written in Italian, but hopefully someday it will be in English. But he explains what he has, what his research is about the neuroinflammation and dysfunction of mental process, an introduction to the importance of a new study perspective in neuroscience. It is exciting to have him. This is a new field, and it's exciting to be able to look at a holistic view that also brings psychiatric disorders and psychological conditions and looking at them from all aspects. I love to hear from you. So subscribe to this podcast, my YouTube channel, connect with me through my website, foojanzeine.com, or any other social media. Share with me what you want to hear, conversations that you're interested in, feedback, anything that helps me to create a better podcast for you. So without further ado, here is Dr. Marcello Tanca from Italy. Dr. Marcello Tanca, it is so nice to have you with us all the way from Italy.
Thank you. Thank you for having me. It's a great pleasure to be talking with you today.
I think that we've been waiting to have this conversation. You have been a visiting researcher at Stanford, and you've done a lot of different types of research, especially in the concept of inflammation and mental health and mental disorders, and how you've brought all of them together. So first of all, what got you interested in this field and bringing these two concepts together?
Yeah, thank you for asking me because it's very interesting. As you just said, I'm a clinical psychologist, and also after my clinical practice, I got my PhD in neuroscience. And I found very, very interesting to study the inflammation I mean, there are a lot of studies that are showing now the evidences about inflammation and mental disorders. And I think is a little bit peculiar to accept and to embrace this new approach, especially I can say personally, because as a clinical psychologist is a little bit different than what people believe about psychology, psychotherapy. But I may say that during my PhD, I found out this relationship between inflammation and psychiatry very, very interesting. And I started studying a specific disorder. The disorder was the Tourette disorder. The Tourette disorder, as we know, is a neurodevelopmental syndrome characterized by the occurrence of multiple motor and vocal tics. And I remember myself finding the information from many, many articles about inflammation causes. And also, I found very interesting the syndrome called PANDAS. PANDAS, to make a joke, is not panda there, is an acronym that stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. So we have a bacterium that can cause symptoms in the field of psychiatry. And I remember myself very, very surprised when I saw patients recovering from neuropsychiatric symptoms after the treatment as antibiotics. And for me it was very, very amazing. And I decided to go deeply inside this field. And thanks to that, I decided to go to study this syndrome at Stanford University. I was very, very lucky because there is a specific research group that studies this specific syndrome. I just said PANDAS, PANDANS, but it's better to say now PANS, PANS, which means that is an overarching term that includes also PANDAS. And the acronym stands for Pediatric Acute Onset Neuropsychiatric Symptoms, and is a broader term. And the meaning is that we have an abrupt, unusual onset of neuropsychiatric symptoms, such as, for instance, obsessive compulsive symptoms, and also tic disorder, with at least two concomitant symptoms such as behavioral, such as affective, cognitive, and motor symptoms. But the important thing is that we have also somatic signs and symptoms. And this is the focus of my conversation today, because I believe that we should take in consideration everything about the body. We should pay attention to what the body is trying to communicate, because, for instance, physical symptoms such as fever, such as, for instance, rash or increased urinary frequency is a sign that there is something about the inflammation that is causing that neuropsychiatric onset.
Is the inflammation anywhere in the body, or is it when the inflammation is actually in the brain?
Yeah, thank you. It's very important, this question, because we are talking about inflammation in general, but also when we talk about PANS syndrome, we can say neuroinflammation. I mean, the neuroinflammation is a very specific inflammation within the brain and the spinal cord, because it's inflammation focused on the central nervous system. And it's important to underline one thing. In the past, because I read a very important book written by Edward Bulmore. He's a professor of psychiatry at the Cambridge University, and he wrote a bestseller. And in this book, he explained very well that in the 80s, medical students, were taught to believe, to know that we had a blood-brain barrier that is a semi-permeable barrier, and it's an interface, highly regulated interface between blood and brain that kept separate blood and brain, immune system and central nervous system. Now the thing is different because we know that we can have that blood-brain barrier breakdown. And we have, for instance, major authors, they are showing a model. And they explain, for instance, that recurrent infection can lead to the production of pro-inflammatory cells. And we know that these specific pro-inflammatory cells are called cytokines that can have, they can produce damage for the blood-brain barrier, and autoantibodies circulating the blood can enter the brain where they can cause damage. So in this case, we can have neuroinflammation specifically focused in the brain. And maybe sometimes when we talk about Tourette disorder or motor abnormalities, we can have damage within basal ganglia. This is the important specification. Yeah.
You remind me of two of teenager clients that I had, both female, which was interesting. Both of them actually had their parents were physicians. And somewhere around age 15, suddenly they started having a high level of anxiety, panic attacks. And, when they went to a psychiatry, they gave them, like Prozac and other types of medication. And that actually caused the mania for them. And then they had to deal with bringing down the mania. And after a while, they've just gotten better and better, and the episode never happened. They did not have this type genetically in any of the parents or family members. And it was always odd in what is going on at that time, where in a specific location, suddenly there's symptomologies that are happening that are not, you can't find the pattern anywhere. And I'm sensing that it seems like it has a lot to do more with the biological factors than just having an onset of a psychological disorder. So if we're looking at it from that perspective, that the psychological disorder is a byproduct of, as I hear you, more of a physiological, a biological, a neurobiological concept. However, the psychiatric symptoms shows up. So obviously parents or people go to a psychiatrist, they'll go to an internal medicine, or from there they go to a psychiatrist. Is there any other suggestions of where else they could look to in order to see where it could be the inflammation of a virus that is creating all of this, instead of putting themselves into the position of taking regimens of psychotropic medication, which might have different types of byproducts?
Yeah. Thank you for asking me. So this is the point. We are talking about a new field of the science of the mind. We are carrying out new research, and we need more study about this topic. So about what you told me about these two cases, it's important that when we have an abrupt onset, I mean 1 or 2 days, and parents can say, oh, I can't recognize my son or my daughter because it's changed in 1 day. This is one important signal. The other sign is somatic symptoms, as I mentioned, for instance, fever or other processes, and where go to. I think because it's a new approach, no matter what is psychologists or psychiatrists, because it's a new approach, and sometimes it can happen that psychiatrists also can give psychiatric medications and not other kind of pharmacological treatments, such as antimicrobics or immunomodulatory treatments. And we should test these patients. This is very important to find increased indicators, to increase the inflammatory indices. And obviously, the thing is that we should consider also other fields of the medicine. For instance, now there is, this is what new studies are showing, there is that overlap between rheumatology and psychiatry. When I was at Stanford, my supervisor, my tutor, she's a rheumatologist. And I learned a lot about physical exam and how we can test this kind of patients. The thing is also that we should make an intervention as soon as possible, because when inflammation started, we should make an intervention. Yeah.
Have you had any research done with depression and inflammation? Because there seems like a lot of the antidepressants not necessarily working for depression, and every day depression is going higher and higher. And, you know, we're not talking only about like psychological neurosis, or even existential or these type of depression. I'm talking about depression that are a little bit more chemical and clinical, and yet, you know, the pharmaceutical companies or any of the psychotropic medication have not necessarily given any cure for it. I mean, they'll, for a while, the 6 months to, you know, a year works, and then it no longer works. Has there been any studies that, you know, attaches or brings together the concepts of depression? Because you talked about anxiety and OCD. Any research around depression and inflammation?
Yeah, thank you for asking me. So depression as well as schizophrenia are the most studied conditions about the inflammation, because depression, as we know, is not only a problem for the mood. We can have various symptoms about depression. And as I mentioned before, Edward Woodmore published this book focused specifically to the new approach for the depression. He focused specifically on depression. And as what we know is that inflammation is highly implicated for depression. But let me tell you something, that this is my belief. I don't believe that we should consider depression or other important psychiatric condition only caused by inflammatory causes. I believe that we should embrace a new approach, a multidisciplinary approach, where we should consider the psychological causes as well, medical causes, for instance, inflammation, infections. We should consider every aspect of our life. For instance, we know that our style life, because this is what the epigenetics is studying. The epigenetics is the study of how our behavior, our environment can affect gene expression, can affect the way our genes work. And these all kind of things can affect our gene, how our genes work. And we should consider everything. For instance, also very different aspects, such as music, figurative arts, philosophy, not only medical and psychological approach. This is my idea.
Yes, I saw that in your book. Your book is written in Italian, And hopefully, any news about having it be in in English at any point?
Yeah, the thing is, I decided once I come back in Italy to share with my colleagues, Italian colleagues, this new approach. And this is why I decided to write the book in Italian language. And other aspect is because I think, from my perspective, that in Italy, we don't have enough publications written in Italian about this topic. And this is why I decided to write in Italian. About other publication, I had working with an important research group are already published. And for instance, we used cutting edge approaches such as the metabolomics. One is metabolomics, the other one is the artificial neural network analysis. Metabolomics is an approach only to explain very easily, is an approach to identify the biomarkers. Maybe through the blood test, we can identify biomarkers and metabolites, and comparing profile the metabolites of, for instance, patients with an healthy group. And this is very important because it can give us an important explanation about what is going on inside the body, specifically with inflammation. And the other articles I published in collaboration with this important research group is with the artificial neural network. We are trying to explain the symptomatology about this new way to see the psychiatric syndromes.
And in your book, it seems like you've also talked about how to look at things from a holistic perspective. So there's also the aspect of if you can have a lifestyle that overall, and we're not talking about disease-driven, but overall reduces inflammation, that you're probably have a higher level of missing some of these maybe psychiatric disorders that would come up. So can you suggest, when you're looking at it from a holistic perspective, what you mean by that?
Yeah, thank you for asking. First of all, I want to explain something about psychological treatments. Because when I use this term holistic approach, I believe that we should consider many fields of the medicine, psychological, because we know we have a lot of psychotherapies, cognitive behavioral psychotherapy, psychoanalytical, and we have a lot of possibility to make a psychological intervention. And about the psychotherapy, this is what I believe, that psychotherapy should be considered as a brain therapy, specifically to reduce inflammation. Obviously, this is not my idea, because I can mention Eric Kandel, that is a Nobel Prize, and he wrote, I think, 30 or 40 years ago, articles saying that psychotherapy is a brain therapy. That means that we can affect what is happening inside the brain, for instance, about the neurotransmitters. And this is my idea. Psychotherapy as not only something abstract therapy, psychological, sometimes is confused as an abstract, is concrete therapy, because obviously during the time, but we can modify something about the biological level. And as I said before, we shouldn't consider only psychology and medicine. We should include also other kind of approach, integrating them.
So the other, so part of that would be, is it that the patient or the client has to go find all of these and bring it together? Or is it that also a system that you're promoting as the research goes forward? There's a system that when you go somewhere, they're looking at all of these approaches all together, such as Stanford or maybe UCLA and some of these places can look at it from a different angle and look at it from a holistic perspective when they're looking at all elements. So as you said, they're not divided. Like each profession is not just looking at their own, although their expertise is on what they're doing, and they bring what they can to the whole, bigger football. But also every other angle is talking to each other. The team are talking to each other to be able to create that. And it seems like there's more needed for those type of holistic centers that actually looks at this from all angles. And as you said, might bring music, might bring nature into it, might bring the Eastern philosophical mindfulness into it, and all of that, while the medical industry is in there and looking at it, psychiatric and psychological, as you said, from more of not only the abstract, but also day-to-day fundamental aspects of looking at the, bringing tools toward a better life, in a sense.
Yeah, yeah. I can tell you the experience from Italy, because I'm working here now, and I can explain this kind of experience. Unfortunately, it's up to the specific doctor, the decision to have a multidisciplinary approach. And unfortunately, I'm hoping now that in the near future, the new generation of psychologists, medical doctors, can have different knowledge about how we can treat patients. For instance, the first question when patients come to me to the first visit is to ask them, how was the last time, how long was the last time you had a blood test, for instance? Go to your physician, to your family physician, and do some blood tests, for instance, because psychologists, for instance, cannot ignore, for instance, that endocrine imbalances or iron deficiency can affect, can also be confused. The symptoms from these two aspects can be confused as psychological symptoms. Cannot deny, cannot ignore these aspects. And maybe we can start the psychotherapy also with a patient having supplements, for instance, is a very simple treatment, but this is only to give you an idea about I would like every kind of specialist should work.
I agree. This is exactly some things that I've started to do, especially it started actually with as I aged and I experienced with some of the people that I was seeing in a higher age female around menopausal time, and seeing how much anxiety and depression was rising, just about because it had to do a lot more with phase of life and hormonal issues. And before, if I only referred some of my clients as I worked with them, but saw that this is a little bit more like organic and chemical, that I would only refer them to a psychiatrist. Interestingly enough, now I definitely refer them back to their OBGYN and other physicians to also check different elements of their blood test and hormonal test and all the other aspects. And then go to a psychiatrist, because as you said, there's so many of these psychological elements that are so intertwined with our bodies. And if we're not aligned in our body, it automatically shows up as so many of the psychiatric disorders. And to be cognizant of it, to know it, to be aware of it, and to ask the questions, to ask the right questions from the client in order for you to be able to refer them. But also, I think, people who are listening to us, to also for them to have this knowledge that they can also go to their therapist and psychiatrist and internist and all of those. And when they see that maybe they're finding themselves into some sort of a psychological issue, for them also to go and do this wraparound check around themselves and make sure that all angles are taken care of, because they're so intertwined together. Dr. Tanca, is there anything we haven't shared that you really want people to know about your research and the future of your research?
Yeah, I want to add something because we talked broadly about this relationship, important relationship between mind, brain, and body. The other aspect is that can help people to understand how important is this new approach is that also, for instance, our gut can affect our mood, our behavior. We have an important axis, gut-brain axis, and we can talk about microbiota. The microbiota is the combination of microorganisms in our intestine, and we can have that is very important for that. For instance, protecting our body is important for helping the digestion, but also regulating mood. And but the thing very important that I want to point out is that the relationship is bidirectional. We can have, for instance, the body that can affect our behavior, our lifestyle, but also our lifestyle and anxiety, mental disorder can affect our body. And this is I think, the very important message that I want to send now.
Beautiful. Yes, there's a lot of research coming across about the gut and how to be able to be more aware of that, and your eating style and how you take care of your body and how it affects consistently. So thank you for sharing that with us also. What is the next level of your research? What's coming?
Yeah, thank you. This is very exciting. And the thing is that this is my hope that in the near future, we can have many treatments to give to patients because this new knowledge infuses a new hope for those patients who are suffering mental disorders, who will benefit, I'm sure, in the next future, will benefit from new treatment options on the horizon for to treat their conditions. And I believe that now, because we don't have specific guidelines to take information about the specific treatments. As I mentioned before, we should consider psychotherapy, antimicrobics, immunomodulatory treatments, as well psychiatric medication, but we don't have specific guidelines to treat, for instance, depression, as you asked me before, or schizophrenia, or specifically the syndrome I study, the PANS. We are improving our knowledge. We are doing as best as we can, and my hope is that we can have as soon as possible specific treatments.
Beautiful. Thank you so much for taking the time to be with us.
Thank you. It was a great pleasure. Thank you.
And for all of you who are out there, create an amazing life for yourself and for everyone around you and your body and your gut, and make sure that you're not inflamed in any format. So take care of yourself, and I'll see you next week. Bye-bye.
Eliminate stress, reduce anxiety, and decrease depression. Dr. Foojan Zeine's awareness integration theory has helped thousands like you get incredible life-changing results. The Foojan app gives you her evidence-based treatment in the palm of your hand. Download today.